Hello and welcome to another edition of the Dr. Brian McDonough Show. Today I have a very special guest, Dr. David Ansell. He is an author, physician, and frankly, one of the people many of us respect as a leading thinker in looking at healthcare inequalities, and how we can make things better. Dr. David Ansell is going to join me. What are some of the ways we can make a difference? I know you've researched it and you've written on it, and you also have lived it in your practice. What are some of the ways we can do better overall for people?
The original outpatient clinics originated at the Hotel Dieu in Paris in the early 1600s, when 6 doctors were assigned on Wednesdays and Saturdays to take care of the needs of poor people. The clinics associated with hospitals have taken that same configuration, somewhat modified, to this very day. But for many people, because of gaps in access to transportation or knowledge, or the right this kind of social means that you need, because where clinics are located in relationship to, for example, in general, neighborhoods of color, but poor neighborhoods in general don't really have access to it. And so the paradigm that we practice under may not be the right paradigm. Let me give you a very specific example. During COVID in Chicago, the mayor pulled together a racial equity rapid response team, and I co-chaired the provider group. And one of the, and of course, it was early in the pandemic and the clinic shut down, but the standard way that patients come to the clinic or make an appointment, even for a video visit, is they have to call up and make an appointment. But we flipped the paradigm during COVID and said to all the providers, what if we looked at the neighborhoods where COVID is hitting the hardest right now and look up our patients from those neighborhoods and call them up prospectively and to see how they're doing and what they might need. So that's a paradigm shift. Right now, our system depends on people being able to get in and to see us. And when someone leaves us, you say, "Oh, come back in a month," but you may not have an appointment. So we have to really rethink the paradigm to a certain degree to bring care to our patients and communities where they live. And that could be home care. It could be in community settings. We just have to think of the extension of the health system and healthcare to go beyond the traditional bricks and mortar approaches that we've taken in the past. Right? It used to be if you wanted a book, you had to go to the bookstore. Same with groceries. Same with anything you bought. But Amazon has changed that paradigm. Think of Instacart with food. So I think healthcare has got to undergo that transformation, which in some ways will include digital access. And of course, there's a digital divide, as well as, really thinking about the home and person-centered care and community-based care. We already have some of this. Models of the school-based health centers, for example, for children, are set up in a way to deliver care where people are located. So I just think it's a paradigm shift, and I think it's high time that we reorganized in that way.